Good morning, everyone, and welcome to our networking event. We're excited that you all could join us this morning. My name is Jody West with Help Me Grow Utah. I'm the community liaison, and we're excited to get going and share all that we have today. I'm excited also to share that most of my team is joining here from Help Me Grow, and they will be assisting with our breakout rooms, so you'll have the opportunity to meet some of them today as well. I know that many of you know about who we are and what we do, but we actually have a lot of new faces today, so we still want to go through and share information about Help Me Grow and the services that we provide. So the first thing is just really understanding that we're a universal program, sharing information and resources to family and community members. With a universal program, that means that we're available for all families in Utah, as long as they have children birth through the age of 8 or prenatal, they qualify for our program. So it doesn't depend on income or any kind of insurance. We're here to support all families at no cost. Our services are also available in English and Spanish. The main way that we support families is through our care coordinators. When a family comes to us, they get paired with one of our parent support specialists. And again, in your breakout rooms, you'll have the opportunity to meet some of them today. And they are the ones on the ground running, working with families virtually, and do such a great job working with them through phone, through email, text, and mail, and making sure families across Utah feel supported. A lot of what we do is help families get connected to community resources, and we're very lucky to have teamed with 211 and have access to a great resource database and have the ability to add resources to it as well. In being aware of what resources are available across the state, and based on families' need and their zip code, we're able to pull up what resources are available to them and help them get connected to those. But a lot of what we do is also a lot of informational type things. Parents oftentimes just need a simple little activity or a tip or an idea of something that they can do in their home to help support them and their child. It may be anything like you see on here, from pregnancy information, developmentally appropriate activities, parenting tips, or information such as information on anxiety, discipline, sleeping, eating, and much more. And that's what our parent support specialists are able to do to support the families and helping them know where they can go for this information and sending it to them. A lot of what we do also is help families get connected to different screenings that they can complete in home. None of these screenings actually diagnose their child with anything, but it's really there to help assist the parents and educate them on development, as well as help us become aware of any concerns at an earlier age. And there's 4 different screenings that we offer, and we're going to share what each one of those are. The first one that we offer is the Edinburgh Postnatal Depression Scale. This is a screening that we offer to women during pregnancy and then up to a year after, to help support them and make sure they're taken care of in their emotional health. The second 2 screenings that we offer are great for all families across the state. And this one is offered from about 2 months to 5.5 years old. And this is a good overall view of their general development and social emotional development. And it's something simple for parents to fill out, where they're just sitting down and playing with their child and doing different activities with them and seeing if they're on track based on their age. And then the last screening that we offer is the Modified Checklist for Autism in Toddlers. This is also known as the MCHAT. We started offering this screening just over a year ago. Since then, about 11.5% of our kids of the screenings that we've done completed by families have been in the moderate or high risk. So since we've offered this, we've been able to help families get connected to additional supports with autism as well, and it's been a great support for families. So if you have a family that you want to connect with Help Me Grow, there's a couple different ways that you can do it. If you're referring directly from your organization, the best way is to do it through our referral form. So we have the form on here, which we can also send to you, but you can also fill this out directly on our website at helpmegrowutah.org. This gives us the ability to take that information and call the family directly and set them up with whether it's they need just extra support and informational things, or they want to complete one or multiple of our screenings. Any of those options we can put together and support the family the best way that they need. And then a lot of what we do is just try to build partnerships across the community. So within your organizations, if you have ideas of ways that you want to partner with us, we would love to communicate that with you and put together a meeting and discuss different ways that we can work together in supporting families across the state. So I'm actually going to turn it over to my coworker, Mallory, right now. She's going to share a success story to kind of give you an idea of what it's like for them working with families and how they support them.
Thanks, Jody. So yeah, I just want to talk about a family. There's a 4.5-year-old girl that has been needing some support, like with physical therapy and things like that over the time that we've been working with them. And we've just kind of been following up with them to make sure that they've continued to have the support they needed for her. And so a couple weeks ago, the family filled out one of our developmental questionnaires, and it looked like this little girl had dropped again with her development in the gross motor area. And so I followed up with the family and found out that they had stopped doing physical therapy. And so I consulted with our child development specialist here, and she suggested that they take the questionnaires that they've done with us to their pediatrician and get another opinion about what to do moving forward, since she had dropped again in her development. And so then the next week, I think it was, I called back to follow up, and the mom said she had already had an appointment with the pediatrician, and they gave her another referral for physical therapy, and they had another appointment on like the next day after I was talking with them. And they figured out a way to make that work financially. Like, that was part of the problem. But I think just us following up with her and having those questionnaires to back up what we were saying helped her continue to figure out a way to help her daughter and get her the things that she needed in order to help her development. And I think she just felt supported in that journey and being able to figure out a way to make it work to get her daughter what she needed. So yeah, that's my story.
Perfect. Thank you so much, Mallory. As you could tell from her story, a lot of what we do, or what they do as parent support specialists, is follow up with families, making sure they get connected. And then those screenings are so helpful as well in helping guide them in the work that they do and knowing what resources are best to help support the families. So thank you. I'm excited to introduce our presenter to you today. Margie was actually introduced to me by Tricia with DCFS. If those of you that were with us in September, she was our presenter then, and she was the one that suggested that we have Margie present, because she thought she would be a great follow-up to her presentation in September, and I think she is. I have had the opportunity to get to know Margie these last couple months as we've met a few times to just plan this and schedule it. And I'm super excited for the information that she is going to share. She is the executive director of the Utah Association for Family Support Centers. And just a little bit about Margie. She has, for the last 25 plus years, has worked in the nonprofit in leadership roles with local and national organizations. In her current role, Margie supports the statewide network of 11 family support centers and 17 crisis and respite nurseries throughout the state of Utah. She is passionate about protecting children and strengthening families. Margie is a native Nebraskan who is proud to call Utah her home since 2010, which we're so grateful to have her here. She's doing a lot of work across the state and supporting the family support centers. And I'll go ahead and turn the time over to you, Margie.
Thank you so much. I'm going to, we had a little rehearsal yesterday with my PowerPoint, so I'm going to hope I do this correct. Yeah, we will get that done. First of all, welcome. Thank you, Help Me Grow, for allowing us to present today. We really appreciate that. And just so I want to express my appreciation for the great work you do, and I'm proud of the partnerships that already exist with the family support centers, and I'm encouraged to strengthen those partnerships throughout the state. So thank you for your good work, and thanks for allowing me to be here. Okay. Make sure I've got that. Hang on one sec. Are you able to see my screen yet?
Yes, we can. Thank you.
You can? Okay. All right. And it says Utah Association of Family Support Centers, right?
It does.
Okay. All right. So what I'd like to do first to start is to provide a quick poll just to get us started. So would you mind helping us with that, Jody? Okay. Why did you decide to attend this event? And your options are: I want to learn more about the family support centers, networking opportunities, or my boss made me. If you could answer that and submit and see what we get.
We'll give it about 10 more seconds for you to answer.
Well, wonderful. Okay, great. So I definitely think you will learn more about the family support centers today and the association of which I represent. As I'm presenting, please feel free to ask questions along the way, or just jot them down, and I have some time at the end where we can answer questions. I really, for networking, I encourage you to stay for the breakout sessions if you can. We have some really good leaders to help you with those sessions. They are our executive directors and some of our program directors from the family support centers throughout the state. And we wanted to take this opportunity to really share and support one another during this crazy COVID period that we're going through. So I think you'll find it really valuable, the networking that you do. Hopefully it'll strengthen you a little bit to get through your day and through some of the challenges we all face. So nobody's boss made them attend, which is great. Thank you for being here. I want to start a little bit by just talking about the association and our family support centers. So if you look at this statement that I have up here, it's about, I want to read it to you. UAFSC is the Utah Association of Family Support Centers. We prevent child abuse and neglect by supporting parents through times of crisis and providing tools to ensure brighter futures. Well, that says a lot in one statement. So I think that you all understand the importance of addressing early childhood trauma. And in tandem with that, we support the child's parent or guardian, who in most cases have experienced trauma in their own lives. So, as Jody mentioned, we have 11 family support centers that are strategically placed throughout the state. And within those family support centers are 17 crisis respite nurseries. So we again focus on the prevention of child maltreatment and the enhancement of child and family well-being. The centers are 24-hour crisis respite nurseries. We have a 24-hour information and referral service at all centers. There's therapy at some of our locations, and parenting education, family strengthening activities. So in this map, you can kind of visualize what I meant by saying that we have centers strategically placed throughout the state. So the colors, the list of the centers are on the left side of your screen. The map is on the right. And the colors represent the areas in Utah. So you can see where the coverage is, where we have coverage throughout the state. One thing I want to mention is that there are plans to expand our centers in the future, but for now, we do our very best to cover every county in Utah. So the next slide I'm showing you are what we call our core services. So if you look at the core services that are consistent in every center across the state. That is those crisis respite nurseries I just mentioned, and we'll talk a little bit more about those soon. Our parent education component, that 24-hour information and referral service. And by the way, many times we're referring to organizations just like Help Grow and organizations of those that are present today. And we all provide family strengthening activities. What we're calling additional services, I mentioned it briefly in a slide before when I talked about therapy. So 6 out of 11 of our centers offer professional counseling and therapy. And then the others have more of a referral system of which they would either contract with or have a partnership with other organizations that do provide counseling and therapy for families. That doesn't mean we don't work with families, but I'm talking about professional therapists, having a professional therapist on our staff. The shelter contracts, most of our, 8 of our family support centers actually have shelter contracts, and what basically those are shelters of which they're contracted with the state agency to be able to take care of children who are removed from the home. So they stay in our shelters for a period of time. So those that don't have shelter contracts have a partnership with an organization that does have one. They're close by. Okay. So we talked a little bit about what the Family Support Center is. So again, visualize those family support centers throughout the state. I'm going to go back a little bit to this slide. So if we look at Box Elder County, which is the one at the very top, this center is actually located in Brigham City, but there's an additional center in Garland. So if you look at your map, you see they're supporting the good part of that northern part of our state. Then in Cache Valley, we have not only a center in Logan, we have one in Hiram and Smithfield, and soon to be hopefully Rich County as well. So going back here, we see that the family support centers, every one of those throughout the state, is their own private nonprofit organization, just as the association is. And so they are independently run. So what does the association actually do? Now, you might be asking yourself, you might not, but the association actually serves as a support to the those family support centers throughout the state. So we may offer support by being an advocate for all those centers. We also may do fundraising that will help support the family support centers throughout the state. Training, like we had a large training for trauma-informed care, which we actually want to train 100% of our staff in trauma-informed care. COVID hit, so we have to make some adjustments. We haven't fully finished that commitment, but we will this year, hopefully. And also maybe guidance on national standards. So we want to be the voice. The association wants to be the voice for the family support centers throughout the state. throughout the nation. So we have a strong voice. That's really what the association does for those family support centers. We want to also just especially to advocate for them to be the one voice. So every family support center, as I said, is an independent nonprofit organization of their own. They each have community boards. The association also has a board that provides support to me as the executive director. It is a new board. I am fairly new in my position, so we have some really great plans for the future of the organization, and we're excited about that. So every center is state licensed. They're available 24 hours a day, 7 days a week, and they help families during times of high stress and crisis. As I mentioned, they offer support, referrals, education, and those nurseries. The nurseries, and the photo I have in here is our nursery in St. George. So they're really wonderful. If you haven't seen one, please visit one. They're just so lovely. They're just a home-like environment where kids really feel safe. Sometimes it's stressful for the children to be there because the parents may be having some stress, but it really is so it's so lovely to be there, and the staff are well trained to minimize some of the chaos in children's lives and families' lives. They have that respite care. That what I mean by that is that a parent may be just at the end of their rope, and they just need a break. They want even if it's to take a nap, clean the house, to go to a substance abuse group counseling, to see their lawyer, to go to a job interview. They can bring their children to the Family Support Center for a period of time at no cost. You told us a wonderful story, Mallory, from Help Me Grow. One story that really resonated with me was a mother who had some substance abuse issues and lost her children. As a result, her goal was to work as hard as she could to get those children back. So she used our Family Support Center when she needed to go to her recovery group, when she needed to see her counselor, when she needed to look for a job. And she got back on her feet, got her children back. And she thanks the Family Support Center for giving her those opportunities. She didn't have to worry about childcare during those times. She didn't have to worry about paying for somebody to support her. And in the meantime, that child was safe at the Family Support Center, also attended parent education classes, became a better parent. The child learned some great skills while they were in respite care. And that's just one example that really sticks with me that I wanted to share with you. I mentioned that we provide shelter care for children 11 and under, and the referral services. So how are we different?
Hey, Margie, we had a question about the nurseries that came through the chat, if I can ask that now. Crystal wanted to know, she understood that there are some things that a parent can't use the nursery for. Are there some things can you give some examples of some things that the crisis nursery can't be used for?
If I could ask one of our crisis nursery directors, I think I saw, is Donette on the call? Or Janelle?
Yeah, I'm here.
Good. Okay. Could you answer that?
Yeah, so the two things that we aren't able to take kids for is for parents to attend school or to go to work. Those two things are considered daycare. And so we can do it if they're studying for the tests, if they're doing homework for school, just not while they're actually attending the classes. And then for employment support, if they're searching for jobs, if they have a job interview, just not why they are actually getting paid to be at work, because those two things are considered daycare.
That answer the question.
That's kind of pertains to you guys, right, Donna? Our contract speaks to what we can turn kids away for, our actual contract. And it would deal with if the child's 12 years old or older, if they have any communicable diseases like head lice, if there's a history of a flight risk or violence that the child may pose a threat to us, or any known sexual behaviors that we don't think we could handle. Also, if the child's documented behavior puts us at risk, or if the parent requests the usage of the documented pattern in disregard for the rules, that's kind of what you were talking about, Donna, or the facility has reached their licensed capacity. So those are the requirements that we could, or the parameters in which we work in to not be able to take a child.
Yeah, so the part I was answering would be what the parents would be doing while the children were at the nursery, and then Katie clarified that if there those issues specifically with the children, that we wouldn't be able to take them for. Is there any other clarification needed for that?
Okay, so on the slide that you have in front of you are some of the reasons for care. The child may be at risk of abuse or neglect. There is a family emergency, as Donette mentioned. They need a stress or respite break. They want to go to treatment or a medical appointment or legal or work obligations. The top reasons that we found for care are self-care, mental health, medical, seeking employment, parenting, and education. So by parenting and education, they're attending a class on parenting or getting additional education. This wonderful building here is called the Family Place. It's located in Logan. Logan, as I mentioned, serves the northern part of our state and Cache and soon to be Rich County. But they offer services in Rich, definitely. But we may actually have a building. So, what are the advantages of having our services? It's as I said here, we really help the family in so many ways, but there are financial benefits to our community as well. And that is that we reduce health and mental health care costs because of the services we provide. I don't need to read that. You can look at that yourself. And then this is another photo of the centers. I'm sorry, I'm looking over here. My other screen is here. But these are photos of our comfort corners. And comfort corners are little areas children can go to learn self-regulation skills. The primary purpose of this mindfulness, as we call it, is to help children manage emotions and their behavior in accordance with the demands of that situation. So in the little picture up here, you're going to see some faces and emotions, and children can identify how they feel inside, what is going on. And they may feel sad, they might feel happy. So they identify what those are. I'm angry or scared, that emotion. And how to regulate that, they may use some manipulatives to help calm them down. You can also see over here, there's a little center that's built where they have a little corner. They read books about emotions. They may play with a manipulative to calm themselves down. And what's really interesting about these exercises is that the children actually teach their parents about self-regulation of emotions. And so the parents learn from the children. It's really interesting. They're really wonderful little corners to help our children self-regulate. Okay, so then the quantitative outcomes. I didn't put a whole lot of this, but these are the numbers of families that have received services and children, the number of volunteers that we've had pre-COVID, the shelter hours, and our total hours with children. I think that what I have learned about our family support centers and our community is that we're kind of the best kept secret in Utah. Some people within a community where the center lies actually isn't aware of the family support center. So I'm so grateful to have the opportunity to present our programs to you. I want to talk to you a little bit about COVID. So I'm going to ask you another poll question. This is fun. And so I want you to look at this about our new normal right now. Hand on heart, as my father, Italian father, would say, are you wearing PJs right now? Choose your answer. Never, 100% yes, business on top, PJs on bottom. I literally took them off a minute ago. Hopefully you have clothes on. So answer that question. Let's see where we are.
I'm gonna give everyone about 15 more seconds to answer.
I love these. I think I have sweatpants on, but I look okay up here, right? Hand on heart, I will tell you the truth. I actually did wear pajamas to a meeting, and I told the group before we all got together that happened, and it was because I wasn't feeling well, and it was an early meeting. I was in bed. I thought I had another hour to get myself together to go to a meeting, and I didn't. So I had 5 minutes. So I went just cleaned myself up the best I could, threw on a sweater, and underneath it all were my pajamas. So yeah, so it happens. But thank you for those of you that are wearing pajamas. We won't ask you to turn your camera on, I promise. If you just change, we won't ask what you changed into, but isn't it odd? I mean, think about the world we live in right now and what we're doing and how Zoom is our new norm. That's just one area that has affected all of us in this COVID environment. So what we did early on in March and April is we actually asked our staff through these hometown meetings, how has COVID affected you? And we had some really interesting answers. So the reason we asked this is because we applied for funding through the CARES Act. So we had our directors on these calls, our therapists, childcare workers, managers, directors, and we got some really great feedback. Now, mind you, that was back in April. We kind of thought maybe this would be over in June, and now we're toward the end of November, and we're still going strong, right? So what we found out in our nurseries is that we had to limit the size of the number of children we saw at any given time because we had to disinfect. We had to social distance. In some cases, the services, no children came at all because they thought we were closed. We are considered an essential service. We were open the entire time. So, you know, they had staff members who were afraid to come to work because they didn't want to catch COVID. There was so much information. disinformation when we first started with COVID, and there still is. You know, they were afraid to get sick. They were afraid to take it home to their families. We had in-person parenting classes had to stop. So we had to adjust to figure out how to do virtual classes to continue to serve our parents. There were concerns that child abuse, domestic violence rates would rise as families experience stress. Now, I want to tell you, in your breakout groups, you'll hear a little bit more about this from your leaders because they experienced it firsthand, much more than I did. So they're going to relate some stories to you that have happened and how not only the challenges, but the triumphs, because those centers and those directors are so resilient. They really have overcome so many of these challenges to continue to serve children and to continue to support our families. It is amazing how resilient and creative our directors have been. Face-to-face therapy. That was another one that we heard about. The therapist had, in some cases, had older computers that didn't even have cameras. So they were using their personal devices to do their therapy. So top priority when we received the fundings was to buy new laptops. So they had the cameras. They could ensure privacy. For their when they were working with their clients. A big one is blurred boundaries. You know, some of our staff are working from home. Think about our parent educators, our therapists working from home that are doing sessions in their own home with their own families present, having to go to a room, maybe their bedroom, their office, close the door. Then they're back, they're still in their home. I'm sure many of you have experienced blurred boundaries. I mentioned secondary trauma. And our therapists are much more equipped to talk about secondary trauma, but they were concerned about long-term PTSD in these situations. And remember, the centers were open since the beginning, before we had information that we have right now. So a big one is canceling fundraising events, the loss of revenue, the added expenses to conform with the CDC requirements. So they have just done a hugely remarkable job in helping to continue to serve our children and families, and we're so proud of all of the work they've done. So I'm going to stop here for a minute, see if anybody has questions. I have a lot of subject matter experts on this call with me, and I want to make sure that we get all of your questions answered.
Margie, we had two more in the chat that I'm going to mention while everyone's thinking. The first one was they were curious about taking kids with autism, and I guess I'll expand on that. Any child that has behavior concerns into your nurseries.
Okay, let's see. So can I have somebody from staff answer that question?
Well, I would say in terms of Box Elder County, can everybody hear me? Because they said my mic was static.
A little bit staticky, but
Sorry.
I can hear you.
Maybe I need to get a new laptop, huh?
We'll talk later.
In terms of autism, and at the Box Elder Family Sports Center, we're not really concerned with diagnoses. Our concern would be, can we accommodate that child? So do we need special skills to accommodate that child? Could the parent come in and teach us some things? And we've had parents come in and teach us things to special needs for their children. So we're not at all opposed to taking any kind of diagnosis in a child. In fact, those are the people we really want to help, because a lot of times autistic kids are more at risk for abuse and neglect, and families are just exhausted because their child's autistic or something. So those are the families we're actually kind of trying to target, I would say. And of course, I can't speak for everybody, all the directors, but I think we all kind of are on that same page.
Can I just say, I would agree, Margie. My name is Janelle Christensen. I'm with the Family Support and Treatment Center in Utah Valley. As long as we can safely care for the child and those needs are communicated when scheduling so that we can maintain the appropriate ratios of caregivers and children. We do have kids who need one-on-one, and we can make sure that we have that staffing in place as long as that's communicated when we have them on the schedule. We just need to know in advance.
Thanks, Janelle. And Katie.
The second question was, is there a limit on how much any one family can use the center care?
Have Janelle, would you mind weighing in on that one?
Oh, sure. Honestly, there isn't a set in stone limit. It's very fluid as far as what the family is experiencing and what their needs are. I think we really pride ourselves on our nursery coordinators being connected and tuned into the family's individual circumstances and needs and being able to meet them where they're at in that moment. I can think, for instance, of a family that we were helping who had 2 children, I think both under the age of 3, and they were leaving a very intense domestic violence situation. And so they were looking for housing, looking for employment, qualifying for different assistance programs. Mom had several different medical appointments to get documentation of the abuse that had been happening, meeting with law enforcement personnel. You know, she had constant things going on as she was trying to leave a situation and find a better situation for her and her children. And so they might have been here Tuesday while she looked for housing, Wednesday while she met with an officer, Thursday while she was at the chiropractor, Friday, you know, and that didn't last very long. That maybe might have been a few weeks while she was getting on her feet. And then as she had those things more resolved, and as she established more natural social supports, she was able to kind of reduce the amount of immediate nursery appointments that she needed and move more to kind of maintaining or preventing maintaining healthy parenting, preventing crisis situations from happening. So again, it's very up to that nursery coordinator to be in tune with what that family needs and being able to meet them where they're at.
Great, thank you. Margie, there was another question in the chat. It says, how do you decide where to locate centers? You mentioned that that you have expansion plans. Can you please describe any planned expansions?
Yeah, definitely. But I first of all I had a chance to look at the chat. Thank you for your funny stories. I love that. So, and thank you, Susan, for mentioning about sensory regulation when I talked about the comfort corners and self-regulation. I appreciate that information.
You're welcome. And did you have an occupational therapist consult with setting those up? I'm just curious.
You know, actually, the comfort corners were based on some of it on that mindfulness training. I'm going to ask Katie if you know, because you have the history of those, do you?
No, I don't.
Okay.
That was kind of born out of that ask for the one funding source.
Yeah, so it really, we were looking at mindfulness training, which is a mindfulness school. I don't know if those were based on sensory input from occupational therapists, but my guess is they probably did.
Anything sensory comes from occupational therapy. We started it, but I'm so impressed that you have those corners, and that is so needed. So kudos to you guys for doing that.
Thank you. Thanks, Susan. And thank you for all the compliments and the positives about the Family Support Centers. That means a lot to all of us. So where do we decide, how do we decide where to locate centers? The location of the centers was done actually years ago. The very first center, I believe, was in Midvale. Jocelyn, I might be wrong on that if you're on the call.
Yeah, it's Sugar House.
Sugar House was the first, yeah. So that was established years ago, and they've expanded since then. So based on the needs of the community. So how would we decide where to place another? I can give you an example of Rich County. We did a needs assessment for the entire county to determine what services were needed there, and it was very evident that a center like the Family Support Center is needed. Those services are needed. We're doing something similar in Tooele. There may be a group of community leaders that will discuss this with one of our executive directors. For example, our center in Roosevelt, a group of community leaders from Uinta Basin has determined this would be great to have a center in Vernal. So we start to look at that and look at the feasibility of establishing services in those communities. The expansion plan right now is a wish list. It's a wish list of where we would love to have our centers. It doesn't, it's as you can imagine, a complicated scenario with a lot of support from the community. So our funding may come from private donations, from the state, from community partnerships. It may be, for example, the mayor knows that there's a space available and she wants a family support center there, along with other community organizations. Every location is unique in the process. If we were to really follow our dream of our expansion plans, we would double our services, literally double, 50% more of what we do now. So we have a great board that will be looking at expansion plans. So they will look at that, but the primary purpose for us is to help stabilize and support what we have in place. It isn't to jump in and start expanding. That we really rely on our executive directors to give guidance as far as what is going to happen in that piece. They serve as advisors to that board, and the board will take those recommendations and move forward.
Reggie, there's 2 more questions in the chat, and then we'll switch to our breakout rooms. The first one is, what are your primary funding sources? And then the second one was, how do you work with older children, for example, 17, who are high functioning autism, or do you only take younger children?
So I think probably the center that has the most diverse funding source would be our Salt Lake Center and maybe our Orem Center. Jocelyn, would you mind talking about funding sources?
Yeah, so we receive state funding through TANF, which all of the nurseries receive it. We also receive CDBG funding, and then some private donations.
Janelle, you want to add to that?
Sorry, I couldn't get unmuted. Yeah, I would echo what Jocelyn said. We have a pretty good mix of state contracts. So through the Department of Workforce Services and the Department of Children and Families, or Department of Human Services, Division of Child and Family Services. We have contracts with both of those. We also have local government contracts through CDBG or Community Development Block Grants to support our therapy programs. And then private donations can come from a pretty good mix of corporations that want to partner, foundations and grant writing, as well as private individuals who donate, like Eagle Scout projects and giving campaigns at holidays and things like that.
Okay, so the second question was working with older children, correct? Yeah, so could I ask Kathy to answer that one, or Jen Daly?
Yeah,
One of
I
you.
can answer.
Thank you, Kathy.
In our crisis nurseries, we serve children ages 0 through 11, but children who are older could utilize our counseling services and things like that. But as far as the nursery goes, it's between 0 through 11, so the day before they turn 12.
I also wanted to mention that we have 2 directors on our call that are from, one from Carbon County, one from Grant County. They have a partnership with the county, so the county supports their centers. Thank you for that, Kathy. Any other questions?
Thank you so much, Margie. If it's okay, we'll plan on sharing your contact information. So if there's additional questions, they can go ahead and reach out to you.
Absolutely.
Also, feel free to reach out to your local family support centers and work with them and get information about the services that they provide as well. We'll be including the recording of this in the follow-up email, as well as Margie's PowerPoint and her contact information. So you will have that within the next week to get more information. So, but thank you so much, Margie. We sure appreciate you and the time you took to present to us today. We're going to go ahead and break into our breakout rooms, and so appreciative to Margie and her team. They will actually be leading our discussions today, and Margie kind of led into it just a little bit with her conversation on COVID, and we're going to go ahead and switch to those rooms now. We hope you can stay and join in those discussions. We're going to stay in there for about 20 minutes until 11:15, and then we'll come back together as a group, and if anyone has any ideas that they want to share together with everyone, there will be someone from Help Me Grow taking notes in your group, so I will be including that in the follow-up email. If you want to even look through those later, you can, but we'll go ahead and switch to the breakout rooms now. All right, we'll give everyone just a second to make sure we get back all together. I know that wasn't a lot of time. It's amazing how quickly 20 minutes can go as you're trying to have such a great discussion and get to know each other. I know my team made some connections within our group of, oh, we would love to offer that to families, and I hope that happened in some of your groups as well. As I told my group, and I don't think I mentioned in here, you will get a list of everyone's name and email of everyone that's attending today. So if you want to be able to follow up with them, anyone in your group, we will have that contact information available for you. So we do have a few minutes here at the end that we wanted to open it up to see if any groups wanted to share anything that you learned within your group, or any thoughts that you think would be great for the bigger group before we end. So I'll just leave it open, see if anyone wants to unmute themselves and share.
Hi, this is Joyce Kim. Can you see me? Sorry.
Yes, you can, Joyce.
Hi, Jody. Hi, Eric. We don't see each other, so it's kind of weird when we see each other this way. It's kind of funky. That's my coworker on the other side of the wall laughing at me because we only see each other sparingly too. Anyway, I'm Joyce Kim from Stewart Health Choice, Utah, and we are a Medicaid plan through the whole state. But I wanted to make sure everyone knew about our online resource website that you can go. It's free, and it's actually nationwide. So if you have a client that's moving or coming from someplace and you wanted to talk to another entity about something, you can go there. It's totally free for you. Sorry, my camera's over here, but my screen is over there. It's stewardcommunityconnection.org, and I'll send it to Jody, and I'll send a flyer on it. You can go on, look whatever you want, housing, medical, DV, whatever, child education, any type of thing, and do it by zip code. So like I said, for me, if I had somebody coming from Hawaii, I could put a Hawaii zip code because they're coming here and figure out who was servicing them, or if they were moving there, I could contact someone there. The reason why it's really important that I ask all of my partners, like you all, is to claim your organization in the Stewart website so that my case managers and my care coordinators can inter-refer the person to you. So it is HIPAA compliant so that we can do it. There is a spot that says that the client doesn't want to be contacted, but they will contact you and your information has been given to that person. It's totally free. The other part is that once you claim your entity in the stewardcommunityconnection.org, is that in the back, even with the referrals going back and forth, there are analytical tools that you can use. And we all know how grants are. You got to get the numbers to make sure that you fulfilled your promise. So those are all there. If you need help, you can contact me and I'll do that. I've already asked if in the future for a Help Me Grow meeting, if we can do a presentation on it. It's really cool. We did one for the community health workers the other night and they all loved it. They loved it so much that they said they were all going to go in and claim their entity. So if I will send that to Jody and to Kaylee and we'll go forward. But if there's anything we can help, I know that this is a stressful time. If you have any programs that you're doing for the holidays, if you can give it to Jody and maybe she can share it with us so that since we didn't have events to do, we still have some monies available. So maybe we can do a donation to a drive, whatever you're doing, a holiday drive or coats or whatever. That's all. And if you need my email, Jody has it, but it's really easy. It's my name, Joycelyn, JOYCELYN .Kim, KIM, at Steward, STEWARD .org. Thank you, and you guys have a happy Thanksgiving.
Great, thank you, Joyce. Did anyone else have anything from their group that you discussed that you thought was maybe a positive thing that an organization is doing that you can share with everyone, or maybe a challenge that you found ways to overcome?
This is Dora, and Jody was in our team. One of the biggest things that we talked about, the strength, is how we've been able to do so many things virtually and meet so many people virtually. Like, I don't think this would have happened if we didn't have COVID. So, and then just something we were talking about, just Shriners, is because of COVID, one of the things they've implemented is a brand new fracture care hotline. So across the state, obviously all the hospitals are taking a lot of care of a lot of patients that have COVID. And so the fracture care hotline, I have a little picture here. The little, I don't know if you can see it right here. But it's a cell phone that's managed by a nurse that has all the training in ER training. So if the family is nervous about going, they can call and say, hey, is this something that you guys can treat? They can send pictures. Same for physicians and families. They can call and they can get assistance that way. So that's one of the great things that's come because of that. So I just wanted to share that with the group.
Thanks so much, Dora. Like Dora said, I was actually in her group. And one of the things that Janelle brought up was one of the positives was how quickly we've been able to adapt. Like, so many of us have easily been able, not necessarily easily, but have been able to find other alternatives, whether it's virtual meetings or cutting down on different things to make it so we're still supporting families. We're finding ways to do that. And our hope after this is that we still continue some of these on, that we can continue virtual meetings and continue the way we sanitize and continue so many other things, even when COVID is done. So we're learning a lot from this too. So has there been any other thoughts anyone would like to share?
It's important to take really good care of our health during this time. And as you know, my caseload has changed and gotten lighter. I've been supplementing, and I've partnered with a global health and wellness company. So I'm totally excited about it because it's health and wellness, and that's what I do with the kids, health and wellness. So just amazing, great good, clean products. And I'm actually telling a transformational story tonight in a Zoom call. So if anybody would like to be invited to that and learn more about ways that you can use things to support your health and things that you could recommend to support the health of your clients, just reach out to me and I would love to have you there.
Great, thank you, Susan. We all have such great, wonderful resources, and hopefully we'll be able to connect with each other even more virtually. Sorry, was there something else? No. All right, is there anyone that wants to share one last final thought?
I just want to thank everybody for participating and learning more about the Family Support Centers. I especially want to thank those of our Family Support Center leaders who took time out of their day to be part of the breakout sessions, and our executive directors and staff and board members who attended today. They're all so busy. So I really appreciate that. I think that the greatest piece of advice I got, or revelation, I should say, from our small group is from Kimberly Alvarez, and she shared a story about her own family and the personal challenges that she encounters. We all forget. We all forget about sometimes ourselves, about taking care of ourselves, and so I think that when she told that story, it was the first thing I thought about was the importance of taking care of yourself and not overextending yourself. And I can say this because I've had a lot of years in this nonprofit business world. So please take care of yourselves. Don't overextend. Don't stress yourselves out. Sit back once in a while and look at the big picture and the common good that we are all doing in our work and in our homes as mothers, fathers, sisters, brothers, grandchildren. We are all doing really, really good work. So continue that, but take care of yourselves. Thank you, Kimberly, for sharing that story.
Thank you, Margie. I think that's a great note to end on for sure. Again, I want to second what she said, and thank you to Margie and her team for taking the time to lead our breakout rooms and have those discussions. I know I enjoyed mine, and I'm sure, I hope everybody else enjoyed theirs too. And definitely take care of yourselves, especially as winter comes upon us and we have these shorter days with not as much light. Finding ways to self-care is definitely important, so thank you. I just want to share my screen real quick to just mention a couple last things. I want you to go ahead and mark your calendars for our next networking event. The invite will be coming out in about 1 month, but we do have our presenter lined up for January 12th at 1 p.m. Esperanza Reyes with the Utah Parent Center will be sharing information about their organization and all the great services that they provide statewide. And if you're not familiar with the services that they provide, they're definitely a wonderful resource to be aware of. And we would encourage you to join with us to learn more about the services that they have. I'd ask to go ahead. We're going to pull up one final poll just to kind of end our event. Kaylee, if you can get that pulled up, if you'll just take one moment to those questions.
We're going to give people about 30 more seconds to complete this poll. Okay, we've gone ahead and ended the poll. I think we got most everybody in.
Perfect. Thank you everyone for filling that out. Thank you for joining our meeting today. We hope that it was helpful to you and learning more about the Family Support Centers and having discussions. And like I said, we'll send out that follow-up email with some information. And if you have any questions for us, feel free to reach out to me and I'd be happy to discuss them with you. Everyone have a great day.